drop whatever you are holding. Please drop whatever you are holding just for a few seconds and just put your hands together to welcome the Honorable Minister of Foreign Affairs. Honorable Minister of Foreign Affairs, it's nice to have you back. We're very happy to see you. Prayers do work. So as you are aware, we are starting rather late, so we'll speed this up so that we don't get cut off before the news belt kicks in. It takes cooperation from both sides. We will do our own side. When you are bringing in your questions, please do so rapidly and let us get back to, before we go back to the studios so that we don't get cut off. So let me invite at this point the chairman of the Presidential Task Force to the podium to make his remarks before we take the technical updates. And if there are other updates we'll give you before we take your questions. Mr. Chairman, sir.
Members of the Presidential Task Force, distinguished ladies and gentlemen of the press, let me take this very precious moment to truly welcome our colleague and our friend, the Honorable Minister of Foreign Affairs, Mr. Godfrey Onyama, back into the fold, and to truly say how grateful we are to God for sparing him in the midst of the ravaging and virulent effect of COVID-19. His story is a clear depiction of the fact that COVID-19 is no respecter of persons, of office, of status, of creed, or of anybody. We thank God for your life, and we are grateful that you withered through quite strong, and you are back very, very hale and hearty. And we rejoice with your family, with your colleagues in your ministry. And we were truly elated yesterday when we saw the great reception and show of camaraderie and friendship and love that was extended to you as you return to your office. We're happy having you back because we know you will continue with your responsibility in the Presidential Task Force of giving of your best because of the global nature of the pandemic itself. Thank you and welcome back. I welcome you all to the national briefing by the Presidential Task Force on COVID-19 for Thursday, 13th August 2020. The country has effectively entered the second week of the extended ease lockdown phase, and the Presidential Task Force continues to monitor global and national trends in the response to COVID-19 pandemic. Globally, the world continues to pursue the search for a vaccine, with over 1,000 trials ongoing and different claims of level of success. We note particularly the announcement by the President of Russia on the breakthrough in the development of a vaccine, even as we study the developments. Fighting the pandemic successfully will take a global effort, and Nigeria will not be left out whenever and wherever progress is made. However, the health and safety of Nigerians will always remain our priority in the pursuit of a solution. For us in Nigeria, we shall focus on propagating the use of proven avoidance methods to break the transmission of the virus and effective case management to care for and treat infected persons. The ravaging effect of COVID-19 pandemic on the global economy should provide more compelling reasons for us all to leave no stone unturned in fighting this pandemic. This week, the United Kingdom will be going into a recession after its economy suffered a slump in growth by a record 20% in the second quarter. I wish to remind Nigerians that ahead of such occurrence, our president was very thoughtful and proactive, and our government had put in place an economic sustainability plan backed by a stimulus package in the sum of 2.6 trillion naira to boost local economies, production, and for all sizes of businesses, including small family businesses. I therefore urge our businesses to take advantage of the stimulus package to revive and or boost their businesses. We cannot afford to let our economy slide. The Presidential Task Force wishes to note, as we have done before, that fewer numbers of confirmed cases have been recorded in the last 2 weeks. This should never be misconstrued as victory over the virus. There is still a serious battle to be fought ahead of us as a people and as a country. It is important, therefore, that we continue to build on our successes and not do anything to detract from them. Our risk communication and community engagement messaging and consultations have been intensified to drive the level of awareness and compliance to the wider population using media and platforms that are most effective generally and specifically. And that's why we would appeal to you to continue to further the course of this propagation using your media outfits. We wish to appeal to all Nigerians to exercise caution and restraint at all times. This is not the time to lower our guards. I wish to note, however, that from reports for yesterday, 12th August 2020, no fatality was recorded. The Presidential Task Force is pleased to associate with the celebration of the International Youth Day 2020 under the theme, Youth Engagement for Global Action, which seeks to recognize the immense contribution and the role of our young people in achieving sustainable peace and development across all levels. Implicit in this is the need to galvanize engagement of youth to significantly enhance peace building, to promote social cohesion in this era of social distancing, and collectively fight in containing the COVID-19 pandemic. The Presidential Task Force appreciates all our young people who have stepped out and are contributing to the fight against this pandemic, and implore others yet to do so to join this fight with all the necessary passion their youthful energy can bring to bear. I'm sure that our risk communication and community engagement strategy would gain a lot of mileage if the various youth organizations and the youth themselves heed this call. It might interest you to note that of the 14,906 evacuees received during this COVID-19 pandemic, close to 80% are youth, for which we are glad that only 684 tested positive to the coronavirus out of the 13,844 so far tested. In the coming days, we hope to receive more evacuees from different parts of the world. The national coordinator would elaborate on this, giving further details as to what would happen going forward. In the course of the week, the United States of America made good the promise made by President Trump to donate medical equipment, including 200 ventilators to Nigeria as a support in the fight against COVID-19. That was a promise he made when he had a telephone conversation with our President Muhammadu Buhari. Nigeria recognizes the fact that the pandemic is a global challenge, and particularly it has impacted the United States of America in several ways. Yet, the bond of friendship has prevailed, and that is very significant, that in spite of the negative effect on the economy and the people of the United States, the hand of friendship is still extended to us, for which we remain grateful to the people and government of the United States. This sacrifice and support to Nigeria is much appreciated. I want to assure the government and the people of the United States that these ventilators, like other materials received from our various partners and other countries, will be judiciously deployed and transparently managed for the good and benefit of our people. I now have the singular honor to call on the Honorable Minister of Health, thereafter the representative of the DG, Nigeria Center for Disease Control, and the National Coordinator to provide us with more detailed technical updates. I thank you so much for your attention, and thank you for your perseverance, your patience. Sometimes these briefings start quite late, but you've continued to provide government and the people with your platforms so that effective and factual information is transmitted and communicated to our people so that they can take personal responsibilities and make decisions that will save them, save their loved ones, and save our nation. Thank you, and have a good evening.
Mr. Chairman of PTF, my colleagues, on the task force, distinguished ladies and gentlemen, of course, the media representatives here present. Mr. Chairman, let me join you to welcome our friend and colleague, the Honorable Minister of Foreign Affairs. You're very much welcome. Even with COVID, you are looking more robust. You're welcome. As of today, 13th August 2020, we have recorded 47,743 cases from 338,084 samples tested. 23,943 persons have been treated and discharged. Sadly, 956 persons have lost their lives due to COVID-19 infection. Our target remains to test 1% of our population across the country. More than 70% of all the tests conducted so far have been in 9 states, including Lagos, Kano, the Federal Capital Territory, Plateau, Oyo, Kaduna, Edo, Ogun, and Rivers State, with 25% of the tests in Lagos alone. We shall continue to work with the state governments to increase case findings and sample collection activities. Yesterday, August 12, 2020, Nigeria joined the rest of the world to celebrate this year's United Nations International Youth Day with the theme, Youth Engagement for Global Action, which seeks to highlight the ways in which the engagement of young people at the local, national, and global levels is enriching national and multilateral institutions. It was also an opportunity to take stock of the contributions of young people to national development. It was a day to reflect on the contributions of young people to the COVID-19 national response actions. I wish to commend our youth who have supported community mobilization and risk communication through social media and community engagement. This pandemic has had its impact on our young people. The evidence available to us shows that 46% of COVID-19 cases in the country are young people between ages 21 to 40. I would therefore appeal to our youth to take responsibility for their health. Let us ensure that we adhere to the advisories of wearing face masks appropriately, regular hand washing, and ensuring respiratory hygiene. We are concerned by the resurgence of infection in healthcare workers. In a bid to sustain the gains we have made in reducing the rate of infection among our health workers, we have made training and retraining of health workers on infection prevention and control a priority. In Abia State, we have conducted a training of 594 healthcare workers from public and private health facilities on infection prevention and control. We are currently investigating healthcare-associated infection in a health facility in Kaduna State. Lessons learned from this will be used to improve service delivery. I encourage our health workers not to lower their guards as the pandemic is still very much with us. Use your PPEs appropriately and judiciously. We have ensured that PPEs are available in all our health facilities. I thank you for listening.
Chairman, sir, ministers and gentlemen of the press, and ladies and gentlemen, going to focus on sample collection today. Since the beginning of the response, our strategy has been trace, test, isolate, and treat. It's only by doing this that we are able to know the burden of COVID-19 in the country. And so with a population with a country as populated as ours, It's not been easy, but we have to continue to push. In line with our national strategy, we have rapidly scaled up our testing laboratory, our testing capacity nationwide. As of today, we have 63 laboratories that are testing for COVID in the country. We have leveraged on the existing laboratories in the country, including other programs, other disease laboratories, and private laboratories to set up these laboratories. In addition to accessibility and improving the turnaround time of our results, our aim is to expand our national testing capacity, which we have achieved. We've also supported states to set up sample collection sites. However, our current situation is the testing labs are underutilized, and that is because we are not collecting enough samples for the labs to test. I think it was mentioned earlier, since the Salah break we've had, some of our confirmed cases have been very low compared to what we've been having before. But this is not because we are getting, the numbers are getting low, but it's because we are not collecting enough samples. If you notice, the number of samples collected during Salah was very low, and we believe it was because of the festival season. Some labs even went on break, which shouldn't have been. So we are working with the state to quickly address this so that we do not have this kind of situation again. Now, what do we want? We want every local government to have a sample collection site in the country. We started a pilot in FCT where we have various sample collection sites within the FCT, and that's what we want to expand to other states. And let's have sample collection sites in each local government in the country. And that will help us to be able to, collect enough samples, and all local governments will be covered. On Monday, we talked about 85 local governments where we did not collect sample at all, we never tested. But if we have sample collection sites in these local governments, they will be able to test or collect samples, and they will test. So, we want to continue to appeal to our states to prioritize testing. And we want Nigerians also to come forward for testing. We know sometimes we look at stigmatization. People say they don't want to go to the testing sites because they will be stigmatized. But, this is not something to be ashamed of. We've just had an example amongst us. It can happen to anybody. So, please, let's come out and be tested. And lastly, I still want to emphasize that this week is World Mask Week. I want to encourage us to use our mask properly and join us in the hashtag #MaskOnNaija so that we can fight this COVID. Thank you.
The Chairman of the Presidential Task Force, Honorable Ministers, members of the PTF, gentlemen of the press, good evening. So today I will briefly talk on the issue of risk communications. The PTF has been working extensively with partners to implement a comprehensive and aggressive engagement response, as you're aware, to COVID-19. However, in the course of this implementation, we've come across a lot of disbelief, a lot of apathy and fatigue. And these have led to issues, challenges with compliance and behavior change among our citizens. But then we do recognize that behavior change takes time. And therefore, if we were to implement a multi-pronged strategy, which is where we are going at the moment, particularly working with our risk communication and community engagement pillar, we should be able to address some of these challenges. So firstly, in the area of risk communication, we continue to communicate messages and the reasoning behind the non-pharmaceutical interventions. So for instance, why do you need to wear a mask? How do you wear a mask properly? Why are we targeting the elderly and vulnerable when it comes to prevention programs? The importance of targeting youth, and also providing information on the symptoms of COVID-19 and where to go and get tested. And in this regard, we have started publishing testing locations in all states and their phone numbers to ease access to tests. Secondly, in the area of community engagement, sensitization and awareness, as well as grassroots mobilization, as it refers to citizen action, we are currently doing a lot of community mobilization in high-burden local government areas through our partners and also state health promotion officers to encourage the use of face masks in a variety of social situations, including motor parks, markets, using motorized campaigns, advocacy with community leaders, traditional and religious leaders. You may have also observed that there's a lot of campaign going on the social media as well as in our TV stations to do with sharing the experience of COVID-19 survivors who are willing to share their stories with us. And we are grateful for their consent to do so. It's really important that we dispel the disbelief on COVID-19, and those that will help us the most are those that have had COVID, because they know it is real. Thirdly, in the area of state alignment and implementation of engagement strategy, we are continuing to engage closely with the states for activities that are critical for sustainability and impact. And this includes working with regards to enforcement of protocols, using mobile courts, fines, etc. And the PTF will continue to proactively work with the MDAs, Governors Forum, state actors, and partners to execute our coordinated and extensive response. Finally, as usual, we'll continue to urge the public to please be vigilant, to remain safe, to remain cautious, and just know that COVID is still very much around and we need to keep ourselves safe. Thank you.
We will take one more update before we cross over for the questions. I now invite the Honorable Minister of Foreign Affairs to the podium.
Your Excellency, Chairman of the PTF, the Honorable Ministers, and you, the media, a very good evening to you all. First of all, I would like to extend my most profound gratitude to the PTF, the Chairman of the PTF, and my PTF colleagues, and indeed also you, the media, because for all the support that you've given to me during these last 3 weeks. As I say, I didn't walk alone, because you were all very much with me, checking up on me every single day, one of you or the other, and keeping my spirits and my morale high. So I really cannot thank you, each and every single one of you, enough for that. You know, when I came today to the PTF meeting that we had before this, I thought that the chair of the PTF would tell me that I'm fired, that I've let the side down, that I'm not supposed to get this disease, so that I'm not a useful member of the team anymore. But thankfully, he didn't do that. He actually even made me chair the session. But really, I have to say that one of the things I was thinking of also was that, the PTF is like a military high command. Before a battle, And it occurred to me that none of the military high command had been battle-tested, had any taste of the war. So maybe it was a good thing that at least now one of the team can speak from experience and not just from theory. But really, as has been said, COVID is very real. I used to think that I used to have what I call a triple protection, as you could see from our previous meetings, my mask, my shield, and even, as the Minister of Information has, air doctor. So, well, it still didn't stop that. So we just have to keep at it. You never know, where it could come from. But I think as the last point that was made, and I had wanted to say, is that the issue of stigmatization, it's nothing to be ashamed of. Anybody can get catch this virus. And it's also, nothing to fear. The statistics are really in favor of survival. It's not a death sentence. And one of the most important things I felt, because, in my case, the moment I just felt something a bit, different, this thing on my throat, on the Friday, I had the test the following day. And it is important to get tested early, but of course we don't have the capacity, we know that, to test everybody that wants to be tested. And I was actually even discussing earlier today with the Minister of Health that maybe in the cases where people cannot be tested soon enough, to recommend a cocktail of some medication, because sometimes, it's a respiratory disease. It starts off at the upper respiratory area, and what we don't want is for it to move down to the lower respiratory area, and it really helps to be on the medication early to stop that. So I think it's one of the things we really have to address in those cases where people don't have access to testing. But don't be, don't feel it's anything shameful to go and be tested or to have this disease or whatever. Just treat it like any other. It could be malaria. It could be flu, and just don't feel that somehow it's a stigma and you're carrying something that would not be accepted and acceptable. And I'd also like to take the opportunity to say that, to thank the medical team where I was staying, where I was isolated. They're really good and made me feel very proud to be Nigerian. We talk about, our medical staff, and sometimes we can be very negative and hard on ourselves. But honestly, for those 3 weeks, I cannot speak more highly of their dedication, their professionalism, and the environment in which one was confined for 3 weeks was really the most agreeable and most pleasant. And I was saying that I could come back there for a short weekend vacation or something, because it really was that good. And I really congratulate them for the work they did. And, last but not the least, I had somebody in Lagos, Dr. Biondo Aluko of Premier Specialist Medical Center, who was there constantly throughout. I mean, in Lagos, but I was always on the phone with, and really kept my morale and giving a lot of very good advice. And I think that we are also blessed in this country that all over we really have medical practitioners of the highest caliber. And it's not surprising, because all over the world we are exporting our medical talent to help even the most industrialized countries in the world. So with those words, I just want to say again, thank you so much for all your prayers, all your support. This is what really helped me through. Thank you.
Thank you, Honorable Minister of Foreign Affairs. We'll take your questions now, but please make it sharp, make it concise.
Mr. Chairman, members of the task force, my colleagues, good evening. My name is Nancy Oyedia Orom from AIT. I would like to start with the Minister of Education. Sir, before now, there was a threat from Senior Staff Association and the Non-Academic Staff Union of Universities. They went back on strike, which I had asked earlier, right? Just like a follow-up. I want to know what you have done concerning it so that upon resumption, our students will not have to wait further before they resume schools. To the NCDC, there was a projection from Dr. Chikwe some time ago that we may be peaking by September. Looking at the fact that our numbers have continued to reduce, which you have actually stipulated that is as a result of low collection of samples, is there still going to be a peak period for Nigeria? And if we're going to have this peak period, are there special preparations for that said peak period? Thank you.
Good evening, all. Rachel Abuja from the News Agency of Nigeria. My first question is for the WHO rep. So how can herd immunity be used to help the development of vaccine? Thank you. My next question is to the coordinator. Sir, as the coordinator of PTF and also expert in this field, I don't know if you've encouraged a study of, let's say, an animal study of these viruses in Nigeria. And if so, what are your findings and if they are implemented? Thank you.
Good evening, Mr. Chairman, members of the PTF, my colleagues, and viewers at home. We appreciate God and welcome back our Minister of Foreign Affairs, our brother Geoffrey Onyema. You have said it all and shared your experience while at the isolation center. Now, Nigerians who want to know, Kaibianolo, Ikowara Hanez and Dinahan, Lega Inse, Kisi Hotel no de Mbino na Ebe de Tarage, na Inwetoria, Tiokwara, Nkowa, Mobihiga Agwa, Ndi na-akpọ oke, nke bekee na-akpọ stigmatization, na ndị nwetagoro ọrịa, kedu ndụmọdụ ị ga-enye ụmụnna anyị ndị ụmụafọ Igbo na-ege anyị ntị, as well en français, s'il vous plaît. Merci bien.
Good evening, Chairman and members of the PTF and my colleagues. I am Itaire Ikwen. I report for the NTA. My question is for the NCDC rep. I understand that voluntary testing for COVID-19 using blood samples is ongoing. So I want to ask if this is likely, what is the status or the rationale for using blood samples, and if this is likely to replace the swab test anytime soon. Also, with respect to the plan to establish at least one sample collection center in every local government area in the country, I want to know how soon you intend to achieve this. Is there a timeline for this? And will there be any priority for 85 local government areas which you said have, which you said no test has been carried out so far? Thank you.
Thank you. We're done with the questions. We will take in responses in this order. The NCDC will take the podium first. The national coordinator will come next, followed by the WHO. Then we'll take the Honorable Minister of Education before we take the Minister of Foreign Affairs. The SGF, the chairman of the PTF, will round it up. So let's begin with the NCDC.
Thank you. Actually, well, I can't really remember when the DG said the projection, the peak will be in September, but that notwithstanding, the situation, you can predict because of the situation at that particular time. Now, we can talk about peaks because people are not adhering to what they're supposed to, wearing their mask. We go out, we see all sorts of everybody without mask. in the public transport without mask. People are not keeping the physical distancing. So, of course, if you look at that, you might just project that, of course, if we are not careful, we might get a peak at a particular time. So we need to do the rightful thing. What do we need to do? To take all the preventive measures. Wash our hands regularly, keep that physical distance, wear a mask. And I think that's what we need to do, instead of looking for a peak. But let's do our own part and hope for the best. Now, in terms of the voluntary testing, I think there is, in Abuja, we had a seroprevalence survey going on. I went on in Abuja. That survey has just, they've just concluded that survey. That was when they did the blood, using the blood sample. And that's just for us to know the prevalence of COVID within the community. It's a survey, and we're going to go to other states to do that. It's something that is still ongoing, so we do not have the results yet. Then in terms of the local government, yes, of course, when you want to prioritize, you look at those that are really not performing well, and so you prioritize those. So our target is to make sure that those 85 local governments that have not tested at all, they've not collected samples, we'll prioritize them. And then, of course, the states are the ones that are implementing this. We're working with the states. And we have used FCT as a pilot. Now we have the strategies. Some states have actually started. Like Lagos State, they have started. Some other states have started, Kano State, for example, also has started decentralizing sample collection in the state. So we're going to work with the states and make sure to support them to make sure that they're able to do this. So I think I've been able to answer. Thank you.
So I think I had only one question, whether would I encourage animal studies on COVID. So, I'm not sure really. It depends on the purpose. So when we talk about trials, we start off with phase 1, phase 2, phase 3 trials, etc. And the initial phase 1, phase 2 trials, you start off with animal toxicity studies before you go on to human studies. So I'm sure there must be some researchers somewhere in the world that are working on animals before they go on to work on humans. But in Nigeria, I'm not aware of this. Obviously, scientists are free to do their research if it falls within the usual ethics of the research. So, for instance, if they want to find out the impact of COVID, how animals could be affected by COVID, because we know COVID can affect canines, a lot of the coronaviruses, because coronaviruses are a large family of viruses, could affect cattle, it can affect camels, it can affect bats, which is probably where COVID originated from. But in terms of doing a specific research on animals, I think toxicity studies will be one. But beyond that, really, if we really want to benefit from research, we should move on to proper phase 2, phase 3 trials in humans. Thank you.
Thank you. I think the question was from news agency. First of all, I would like to remind how vaccines are developed. It starts with pre-clinical trial. So when they test the vaccine in animals to see whether they can produce the protection, the antibodies. After that stage, the vaccine development goes into a first stage where it's tested in a small number of individuals to test its toxicity or its safety. After that, if that phase passes, it goes on to the next phase. It tests a little bit more individuals to see if that vaccine can protect. And then the antibodies are measured in the blood. When that stage passes, it goes on to the next stage where a large number of people individuals are tested, are given the vaccine to see whether there is a protective effect, whether the large proportions of those who receive the vaccine develop protection against the virus compared to a group that did not receive that vaccine, receive a placebo, like we say it in scientific terms. And then when that phase passes, it then goes to pre-authorization, regulation, so that it could be given as a public health intervention. So now, herd immunity is the protection developed by a population as a result of that population being exposed to an infectious agent, like the virus. It could be naturally, like what's happening now with COVID, infecting more and more people. If it results in more and more people developing antibodies, like more than 60% of the population, it may end up protecting the others. Herd immunity can be developed also as a result of vaccination. If more than 60% of a population have received an effective vaccine, which is clearly protective, then this could also protect the other members of the community, even if they didn't receive the vaccine. So the question was about how herd immunity can help vaccine development. I wanted to dissociate the two processes. First, it's the vaccine development that can produce an effective vaccine, which could then be used to produce herd immunity in a community if the larger proportion of that community has been vaccinated. It's not herd immunity that helped the vaccine development, but we could use the result of the vaccine development to affect herd immunity in a population. Thank you.
Good evening, everybody. The question as to what we're doing with ASU has been repeatedly brought forward, and I've said ASU is the foremost union in the universities, and over the years, through their engagement with government, they have achieved a lot for the education process. At the moment, they declared a strike action in March, ahead of Corona's own strike. So, while they were on strike, Corona struck. And both of them have kept all our children at home for the past 5 months. It will be up to the national body here, because we are working towards a national response. Once the PTF assesses all the data around the science that is coming up as it evolves, it would then inform us whether to open the education space to at every strata. Today, I met with the proprietors of private universities around Nigeria. Their argument is that markets, churches, everywhere else is open. Why shouldn't their own private universities open if public universities and institutions do not want to open because of ASU? And I told them that's a continuing engagement, because everything that ASU is asking for is also for the welfare and uplifting of the university system. However, we have run into an emergency, and we would need to do a lot more than just do strikes to get our children back on stream. So the appeal that has been made by a lot of well-meaning citizens to ASU is maybe they should give a moratorium as to strike actions for the next 10 years so that Nigerian university system can rebuild before we start further agitations. But that is also something that people will take into context in what it is that they are able to achieve. We are working with the science as we know it. When that is ready, and when the country is ready to open, we do not believe that ASU will be unreasonable. ASU are mainly made of professors, nearly 65,000 university lecturers with 10,000 professors in Nigeria. There is no way they can be illogical. I'm almost confident that they will know, as well as you do, that children need to go back to school as soon as we are ready. Thank you very much.
Honorable Minister of Foreign Affairs.
So ajụjụ ha jụrụ nkịta bụ nkọwakwa ife nkọwa bụ n'oyibo. More just ịgwa unu that na oge ọya bidoro o were ebe dịka ụlọ ọgwụ nje, and o doro m anya etu fasi eneta ya ebe afọ. Ha netere m n'ahịa ọfụma, and ndị doctors na ndị niile n'ebe ahụ bụ ndị mmadụ n'ọlụfa, and falụlị ọfụma. And ife ọzọ nchọbụ ikwu bụkwa that na ifele adịrọ ọya, o wee ọtụtụ mmadụ na-achọrọ ka ha ma na ha na-ayọ ụtụrụ ọya dị etu a, nwekwe ndị na-achọghọ ije mee test ka a mara na ọya a na-egbufa. So if I chọrọ igosi bụ that na ọ bụrụ ife ifele, ọ dị ka ịba ma ọ bụ ọya ọzọ ndị mmadụ na-eweta, and so ọ dịrọ mma ka a na-atụ egwu kedu ihe ndị mmadụ ga-ekwu na ihe dị etu a. So biko ozugbo unu fụ that na arụ adịtachara unu, kujenu mee test ka amalụ. And ife ọzọ na-ekwukwe bụ that na amakwa that na ọ bụrụ oge ncha ka oge a ga-achọ test ka a ga-afụ ndị ga-abịa eme ya bụ test. So a na-agwa minista ndị ọya, ndị health, that na ikekwa that na ọ bụ na ha ma that na ha ma nwee ike test ndị mmadụ n'oge, that na ikekwe na ọ ga-aka mma ka fagwa afa ọgwụ fatosid na-ahụ na ihe dị etu afọ. mana biko na ọya afụgo n'okịta that na ọya dị. O wee ndị na-asị that na ọya adịrọ, mana ọ dị sure n'ike. So ka anyị gbaa mbọ mara that na-eso ife ndị gọọmenti PTF ndị mmadụ na-agwa anyị ụzọ a na-asị ka a soro ya bụ ụzọ. And because ife dịkwa n'ọya bụkwa that na iweta ya iwe ike ihe ndị ọzọ, you see. So ọ bụrụ ọsọ gịwa ga na-eweta ya bụ ọya. So biko gbanụ mbọ ya bụ ihe ife nkwu. And on m'a demandé aussi de parler en français, d'accord, pour dire un peu la même chose. Donc, en effet, ce que j'avais dit, c'était que oui, j'ai subi cette maladie et j'étais confiné. Mais l'endroit où j'ai été confiné était vraiment un endroit impressionnant. Les médecins et les infirmières qui étaient là, ils étaient vraiment au premier rang, très professionnels. Et l'environnement aussi était très, très impressionnant. Et ça m'a fait vraiment fier de qualité de nos ressources dans ce pays médical. Et donc, félicitations vraiment à eux pour l'excellent travail qu'ils ont fait. Et puis, j'ai parlé aussi du fait qu'il ne faut pas avoir cette stigme concernant cette maladie. Parce qu'il y a des gens qui se disent qu'est-ce qu'ils vont dire et qui ne veulent pas être associés avec cette maladie. mais vraiment c'est une maladie comme d'autres. Et il ne faut pas avoir peur, il ne faut pas se sentir comme s'il y avait vraiment quelque chose qui ne va pas avec la personne. Et aussi, il faut prendre les mesures très vite. Il faut être testé aussitôt que possible. Je sais qu'on n'a pas toujours la capacité de faire le test tout de suite, mais dans ce cas-là, il faut quand même, comme j'ai discuté avec le ministre de Santé aujourd'hui, que dans des cas où peut-être on ne peut pas répondre assez vite aux gens qui ont demandé pour le test, ils peuvent peut-être aussi leur recommander quelques médicaments parce que c'est important de commencer très très vite le traitement pour cette maladie. Donc voilà en effet ce que j'avais dit en anglais. Merci beaucoup.
Thank you, Honorable Minister of Foreign Affairs. There's actually no question for the chairman, but we'll invite him to the podium to close this session.
Truly no question. This is a very good day for me today. No, I can't. Just to, yesterday I had, an experience, and I was sitting beside the television. I think it was in the office, and I had the two experts in the United States, Dr. Fauci and the DG of the CDC. They spoke at different times. They were interviewed at different times. And their remarks were similar. For the DG of the American CDC, I was expecting some new message with regards to our fight for COVID-19. But he said exactly the same thing that Dr. Fauci said. And what is it? The 4 things that we've been pushing all these last 4 or 5 months. And he was very emphatic about it. He said, there are only 4 things that we got. And if we can just do these 4 things, we'll be able to tame this virus. If we don't do them, there are dangers ahead. Now, what are the 4 things? 1 is wearing of mask in public spaces and when you appear in the public. And I'm glad that this week, as we get to the end of the mask wearing week, tagged in different terminologies, either Niger on mask or hashtag wear a mask, it has become so obvious that that's the only weapon we have in our hands to fight this pandemic. And the second thing he said is keep social distancing. Don't congregate. The third, maintain personal hygiene in terms of washing of hands or sanitizing them. And the fourth, avoid large crowds. For whatever reason, don't find yourself bundled up with all kinds of persons. You might have done all these things and just let your guard or lower your guard in one of them. You never can tell. Probably that's when the virus will strike. You can put on your mask, you can observe social distancing, you can sanitize your hands, you can wash your hands. But if you go into a congregation, a large congregation of people who have decided not to wear a mask, there is a risk attached to that. And Dr. Fauci, too, in a different interview, repeated the same thing. Why am I emphasizing this?
just to drive home the point that for now, nobody is even talking about the vaccines. Nobody is even talking about the cure. Because you must remain alive and safe until the vaccines show up or any form of cure is found. So my appeal, and by extension, you are the carriers or couriers of this message, is that let's remain with these 4 non-pharmaceutical interventions or measures that we have for the last couple of months emphasized over and over again. Wear your mask in public places or in public spaces. Don't leave your house without your mask. Don't assume that your friends are COVID-free. Don't assume your family are COVID-free. Take every necessary precaution to stay safe and to stay alive. Maintain personal hygiene by washing of hands. Thirdly, keep social distancing as much as you can. Avoid congregating in large gatherings. That way, collectively, as a people and as a nation, we'll be able to tame the ravaging effect of this COVID-19. You've had the personal experiences of the Honorable Minister of Foreign Affairs. And the beauty about it is that we were all together in it. I know a lot of you kept sending messages to him, encouraging him. You were not asking questions, how did he get himself infected? Because anybody can be infected. Presidents of nations have fallen victims. Prime ministers, their spouses. People have died that you know, that I know. So don't ask those questions. Let's be together in this. And collectively, I believe that if we respond in the manner that we ought to respond, and with our figures sliding, though we know the reason, collection of samples have been low, but our positivity rate tells us that if we can do these things, we can manage the pandemic, the virulent nature of the virus, and hold on until a vaccine or a cure shows up. Thank you and good evening.
Thank you, Chairman PTF. We have done this in exactly 1 hour, 4 minutes, which is quite encouraging. I do hope that we'll be able to sustain it in subsequent national briefings. A lot of messages have come out of this, and in case you're watching us and you missed any part of this national briefing, just a quick reminder that we have congratulated our youth on the International Youth Day, which was celebrated yesterday. We recognize your invaluable contributions to national development. And we also recognize the role that you can play by taking personal responsibility in this fight against COVID-19. We want to remind all business persons, directing minds of various sizes of businesses, that government has provided a stimulus package which you can access. Just search for the information, meet all the conditions. We want to keep your businesses afloat, want to keep employment going, and want to keep production going as well, so that the economy can stay on the right course. Risk communication is the business of everybody. No one is exempted, and same goes for community engagement. You must play your part. Don't be fatigued. Remove disbelief. COVID-19 is not a death sentence. There's nothing to be ashamed of. Do not stigmatize. Always encourage everybody to get tested when they feel the symptoms, support them. The virus does not discriminate. Help fight the virus and tell your story so that others may believe that this is real and we are all in it together. There's a strong message, very strong one, on wearing of mask, and you must wear it properly. Protect yourself, protect your loved ones, protect the elderly and the vulnerable, protect the youth. Share your experience. COVID-19 is real. Finally, we have been told that we have a blessed nation. We live in a blessed nation, and we have the best of professionals that put in their best at all times. You just heard it from the Minister of Foreign Affairs, that our doctors are marvelous, and we thank them, we support you, we continue to pray for you at all times as you make sure that we stay alive. God bless Nigeria. That brings us to the end of this national briefing. We hope to see you on Monday by the grace of God. Thank you.